The health of your employer brand is only as strong as your willingness to face the truth behind your employee feedback.
Yeah.
So,
And
it's kind of
that's a
like
beautiful,
that
yeah.
marketing message, right? You can say what you want about your employer brand, but at the end of the day, it's really about the lived experiences of your employees and what they have to say about it.
Hi, I'm Brad Munch, CEO of Symmetris, the digital agency that helps healthcare organizations extend the lifespan of their website. And today I am joined by Cynthia Newton, who is a consultant with decades of experience in healthcare marketing and who's focused a bit more recently on HR brand. So today we're here to talk about how to improve on the HR recruitment page on healthcare websites. But first, I'd like Cynthia, if you could maybe introduce yourself to our viewers.
Sure. Thanks, Brad, for inviting me. I'm Cynthia Newton. I head up Cynthia Newton Consulting, very original. I've been in healthcare marketing for about 25 years, spent the last 15 years focused on helping healthcare organizations improve their reputation online for consumer experience, so the patient experience. And that brought me to focus on a lesser focused on area, which is employer brand. And so hence we're going to talk about what does employer brand look like? What's that experience for potential employees on the website? And hopefully we can have some fun.
Yeah, absolutely. Yeah. And I think that even though healthcare marketers are usually more focused on patient acquisition right now at the executive level, I think there's less of an urgency to acquire patients, and it's more about how do we deliver care, how do we recruit new members for our staff. And so I think this conversation is super timely, and the overall trends are showing that the demand for healthcare is going to grow and the labor pool is probably going to shrink. So this is going to get even more, I feel, relevant as the years go by. So, first of all, I know that you've kind of digged into the different numbers that we have here. Do you have any, like, out of the top of your head, some kind of statistics of like what's going on with recruitment these days, or what are the challenges that health systems or hospitals are facing?
Sure. It is alarming. If we look back over the last, I would say, decade and a half, if you were coming into healthcare as a provider, whether that's an MDDO, mid-level provider, or any role in healthcare, we're pretty static. Healthcare is not going away, right? If anything, we have an aging society that requires more healthcare than ever before. The problem is now, and it's not just a COVID reaction, we lost a lot of providers after COVID, during COVID. But looking forward, which is we always should be looking ahead at look at our potential growth from a patient volume, but then what kind of staffing requirements are we going to have? We are looking at a potential shortage in the US for 124,000 physicians by 2034. And that's really alarming. We are working hard within,
Trade.
I think, the industry as a
And that's
whole
just the
to look at
physicians.
mid-levels. That's just the physicians. Expand that to nursing. Nursing is one of our highest turnover rates for any organization. It's averaging between 18 and 23% for registered nurses. The cost, when we look at what the implications are of that, not just in for fact that for the turnover, it is a huge cost in many ways from a recruitment standpoint, a training standpoint, being able to hire from outside with, the travel nurses, quote unquote, to fill those positions. I mean, it's very expensive to replace our staff. And that's probably where we're taking the biggest toll is the cost of keeping up with retention and recruitment. So the first step is to retain our employees. And that's going to come down to what is that employee experience, right? We don't want to have that turnover because we're already looking at a shortage coming up for percentage of patients that we haven't even had yet. So we want to retain, but then we also have to look at how we're recruiting. How do we compete in a very tight market with not only healthcare providers, but for a lot of our entry level positions, for our support positions within the organization, we're competing against other employers, not just healthcare employers. So that's another factor that we have to weigh in on as well and be able to position ourselves in the marketplace and be able to show what that employer brand is and help it us to effectively recruit.
Yeah, absolutely. I think that there maybe was a
Did I lose
time
you?
when just kind of, posting a job was sufficient right? To attract that talent. But right now it's kind of a quote unquote talent war and trying to get these different experts in the field. And even the kind of, frontline kind of workers of that, as you said, are competing against these other industries. And so what I'm not understanding on my end is how come on the websites of healthcare organizations they're not spending more energy and investment on making the career section or the career hub of a hospital website more engaging, more thoughtful. And I think I have a couple of things that I've noticed as I've researched this. And on our end we're just about to publish, or we just published a list of what we found being the top strengths and weaknesses of the top 100 hospital websites and health system websites throughout the US. And only 25% of those health systems actually have a dedicated career page or a section. And more than half of them, so almost, three quarters of them are actually just linking straight to the ATS system. So that there's a list of jobs on their website, but there's zero experience for the candidates. And then when those pages are there, they're trying to apply for a job and it's super clunky. It's like millions of steps. It's kind of like the hospitals are actively trying to make this more cumbersome and add more friction to actually giving an applicant the chance to apply. And then once that's done, it's kind of like the whole process is invisible for the applicants, so they don't understand like what's the next step. They're not getting notified of, hey, your CV has been received and or we're reviewing this and within 2 weeks we're going to get back to you. So I feel there's a lot of stuff that can be improved, and that's not even talking about the UX or the design of those pages, especially on mobile, which is horrible, very difficult to interact with, especially with the forms. So I think there's so much stuff that can be done to improve on that and to make that experience for the candidate better. And I think that ties in directly into what you were mentioning about the employer brand, because if your experience to apply and trying to find a job is clunky, then that directly impacts the perception of that brand, how much they care about providing, potential candidates a smooth experience.
You are spot on. Before we even get to the website, though, some of the things that we applied on the consumer side are very applicable. So, what I'm learning is that a lot of the strategies, the tactics that we use to acquire patients, when we start thinking about how for the last 10 years we've really been focused on the patient journey, we need to refocus on the employee journey. What is that candidate
Yeah.
journey like? So where do our candidates come from? And from wherever they start, whether that's on LinkedIn, right? Because LinkedIn has job posts, whether that's Glassdoor, Indeed, whether that's, another type of ad that they've run across on a local website. Before they even get to our site, we need to start mapping that journey from there, right? And so some of the important things in that overall journey is how they're evaluating what's the first impression like. So no different than the consumer side. When you're talking digital and first impression, what's that first impression of your brand like for those potential candidates? And that's where the reviews come in, right? On Glassdoor and Indeed, or people's stories that they're posting on Facebook or Reddit or LinkedIn about their employee experience. So we need to start thinking like we did
But
for consumers and start talking about meeting what's where they're at.
yeah, well, what I was is trying to what we've seen on the patient side in hospitals and health systems is that there's the tendency of people to leave reviews or like be it on Glassdoor on the candidate side, is they're going to leave the when they have a negative experience, they're going to leave that review, and when they have a positive, they're not going to think of doing that. And there's been a lot of effort done that through different tools. And I know you have a relationship with a physician MD, I think, who who improves on that. So how do you get those employees to leave the good reviews on the website?
It's great that you bring that up. So there's a thing called negative review bias, right? So left to organic reviews. So organic reviews meaning I'm not soliciting, I'm not asking for feedback. It's just people go and leave feedback. That's very much driven by negativity. Consumers, employees, People, when they've had a negative experience, are much more motivated to leave a review on a third party site. They just want to be heard. So, unless we're giving them an opportunity to be heard by either asking and providing them an outlet, we're going to continue to see that high propensity for negative reviews on third party. The moment you start requesting feedback, so we've done a really good job in healthcare at requesting feedback from the patient side. So we've seen by activating your entire, patient base after they've come through either your hospital as a discharge or have visited their physician, we see a huge jump in overall ratings going up because you're hearing from people who have had positive experiences because you've asked. So the same thing rings true with employees. By asking and engaging with our employees to leave reviews on third parties such as Glassdoor and Indeed, we're going to see a better representation of what our true employee experience is. So, working with a large regional health system down in Florida, we started doing that in May of 24. We rolled it out where we consistently asked for feedback from our employees who are celebrating an anniversary of 3 years or greater with them. And what we have found was that we grew our Glassdoor rating from a 3.7 overall to a 4.1 in 9 months. So that's a huge jump. We average about 45 to 50
For
new
sure.
reviews monthly. And that has helped land us on Glassdoor's top 100 employer list. So that's across all employers. So previously we were 3.7, now we're 4.1, landed on the Glassdoor employer list. And we're using that feedback effectively internally too to repurpose the feedback. So we're identifying potential employee advocates for the organization. We're also taking quotes and sharing them in social media posts. We're using them internally to share with our employees to show that positive sentiment and encourage additional feedback.
And once you got that, which was quite impressive to bring that in just 9 months, like half a point, right, on the Glassdoor reviews, and you're over four, which is a huge lift overall. Does that have impact on the number of candidates that have applied for those roles? Like, what's the impact of growing that level of review on the organization itself and its recruitment?
Good question. First off, we have this organization has a sponsored profile on Glassdoor, meaning that they have ads that are running on the Glassdoor site that promote their brand along with their star rating. And you can't control whether your star rating appears or not. So if you have a low star rating and you're paying for it to display across other people's organizations' pages, it's not going to work all that well. So, what we've seen with a higher rating displayed on those ads, we're seeing more impressions on our job postings, higher click through rates. We have doubled our click through rates on our job postings. So, it's been really positive as far as driving ROI on the dollars that they invested in those platforms. The tougher thing to track, and I will say that a lot of organizations are trying to do this, just like any other form of marketing is delivering that ROI, right? Yes, a higher rating is great. More click-throughs are awesome. But at the end of the day, did it help us have a faster time to fill? Did we have higher qualified candidates? Did we have more job applications filled out and submitted due to that increase in rating? And those numbers I'm finding are not that easy to lock down. So we are working within that organization to put is in place where we're going to have more numbers such as that to bring back to leadership.
Yeah, from my experience as well, like one of the challenges that organizations have, even if they've created a great career page and they're talking about the different locations and geographies, and if they have to move to other regions or adding more insight into the overall experience for the employee so they can better manage their expectations. One of the things that seems to always be kind of evasive is really measuring those things, straight through. And sometimes it's because the ATS system doesn't, the applicant tracking system doesn't you can't convert on that exact click and how it went through, and the URLs don't work exactly. So there are some technical background elements. Sometimes the tools are not able to connect, or it's difficult to measure all those different steps. But overall, what I've seen on the client side is that health systems can see like there was an increase overall in applicants or things like that. And so they can have assumed that it was because of these changes that they made. But obviously, there's always a bunch of different campaigns going on and initiatives, so we can't pinpoint one specific one. But that is something that a lot of organizations are working on to improve that traceability of that metric to prove the value of the effort that's been done. I'd like to kind of maybe just kind of do a quick kind of sideline on actually implementing that, because there's a lot of the thought process behind the strategy of how we're going to approach it and make this more aligned with the perceptions of the candidate and their own journey, as you were mentioning a bit earlier. I can talk a little bit about the implementation online of these different things. And we both have had experiences, and I think you can maybe talk a bit with more kind of all those years of experience on how to align the governance around that. So the technical side of things is, if we're just creating experience pages on the website, it's certainly not that out of reach to be able to create that page on the website, to make it more prominent in the navigation, to focus on certain elements that are going to be interesting for the employee or future employee's journey, getting some videos in there of testimonials of existing employees who can talk about their own experience, and they can connect with that, maybe separate it by um, type of role. So some organizations recruit the physicians and then the nurses and then the frontline personnel, and have different kind of zones that they can look at. They can talk about the overall experience, about the employer brand, and what the overall feeling of being an employee of this organization is and how it differentiates. And then there's the connection with the ATS. As we were mentioning, sometimes it's very difficult to implement a visual brand on that ATS system, and it can become expensive to connect them by API, but it's doable so that the exact interface of the website is fed information from the applicant tracking system with all the different job postings so that everything looks seamless. But there is a moment when the person actually submits their form. Oftentimes that becomes, you've transitioned over to that system. Kind of the patient, when they try to log into their My Chart, it doesn't look exactly the same as the website because Epic is not as easy to customize. So those are the challenges we've seen on the technical side. And there is a bunch of challenges on getting that implemented. But on the governance side, obviously, it's how do we align marketing and HR teams at the top. And that's something that it really depends on the organization, from my experience, where if one organization, marketing is more of like, HR is an internal client and they're saying, hey, could you deliver this for me? Could you put this on the website for me? And other organizations are more partners, HR and marketing, and how can we approach this more strategically? But Cynthia, could you give me a bit of insight on how you've been able to approach this to get the HR brand be top of mind, and then focus on making sure we're getting the reviews, and focus on making sure the patient experience is front and center for HR, but also for marketing?
Yeah, those are good points, Brad. It's interesting because, like you said, it differs from organization to organization. So a lot of the time, what I'm seeing is that HR owns job postings. That definitely falls in their bailiwick. So 9 times out of 10, they are owning those and Glassdoor and Indeed relationships. A lot of the times they are using marketing as their agency and more or less placing orders on what they are requesting from a branding standpoint. And what I'm seeing is there's not necessarily a lot of strategy or focus on the employer branding, right? And how it aligns with the overall brand and how that plays or interplays with the consumer brand, right? So your employee brand, definitely employee experience drives that consumer experience. So I would say that beyond just marketing, having that conversation with HR and having that open dialogue, it also is PX. I feel like PX should also be involved in that because if I'm a PX person and I'm responsible for the patient experience, and if my patient experience is suffering at all, where am I going to go? I need to also have that relationship with HR because that employee experience is definitely impacting my patient experience. So it really is like that perfect trifecta of a relationship. One of the things that I would strongly recommend when we start talking about career pages is the videos are great, but you know what? It's like a marketing function where they're curated, right? Patients are very aware of curation. You're not going to put a video up there about the employee experience that might be negative or have some concerns about something that occurs within the organization. So we're going to take a page out of transparency from the consumer side. So for about 15 years, if not longer, we've been publishing our CAP scores as converted 5-star scale to our Find a Doc. We're publishing them to our service line pages. And it's a signal that patients are looking for. They want to see feedback from other patients on what is that experience like with that doctor or that hospital or that service line. So I'm going to tear that page out of that playbook and pop it over to HR side and say, we need to be offering transparency on our employer brand. So what is that employee satisfaction or employee engagement survey saying about the experience as an employee? Converting that to a 5-star, publishing that on our careers pages, the good, the bad, and the concerning. But it's being that transparency factor that future candidates, potential candidates, are wanting to see that feedback on that side of the house as well. So that transparency, employer transparency, is going to play not only a role in delivering that information that the candidate's seeking, but it also has a play from a search component, right? Those stars are indexable, just like on the consumer side. Start talking about AI, the AI results that are coming out, or even having the bots from Chat GPT being able to reference sites and be able to pull out data points. It's about relevancy. It's about answering those long tail questions. A candidate saying, who's the best employer in St. Louis for neurocardio nurse, on the, whatever floor. You need to be able to answer those questions. And so by having that feedback on your site, you're more than likely going to get insights that are findable by these types of inquiries versus just a video that's not necessarily going to index beyond just that tight description you might have attached to it.
I 100% agree with the authenticity aspect. And I think it's about like, walking the talk sometimes. And now we're kind of going a bit off the more digital sphere of things, but employer brand should not be just aspirational. It has to be real. It has to be based on what's going on right now. And you can't just say we have the best employer branding, blah, blah, blah. But then if everybody's giving you bad reviews and nobody likes working there, there's that dissonance. And I think that it kind of forces
Mhm.
the organization of saying, well, if we want to really attract the best talent, we have to be a best employer for real. People have to really want to work here. So, and that kind of then, how do we communicate that through the organization? You were talking about, the people themselves that are going to give those reviews and share the reality, those employer surveys internally that are shared to the outside to show how this organization really is transparent about who they are. I think there's an element of making sure that connection, because there's oftentimes so many employees, it's difficult to kind of connect with everyone. And one of those hubs often is the intranet or other types of tools like that. So those have to be able to think about that employee journey as well and that retention cycle, and not just be like a place where you dump information about, the next holiday season or whatever. And so I think all these kind of things interconnect at the end of the day, but it's all about being coherent with, the reality and how we're projecting and where we're investing as an organization. And it's not, as you say, marketing up to a point, but you can't overpromise and underdeliver. And I think it's the same thing with the HR brand at the end of the day.
Absolutely, absolutely. Um, I'm going to put this quote out there. The health of your employer brand is only as strong as your willingness to face the truth behind your employee feedback.
Yeah.
So, it's kind of
That's a
like
beautiful,
that
yeah.
marketing message, right? You can say what you want about your employer brand, but at the end of the day, it's really about the lived experiences of your employees and what they have to say about it.
And so, and to kind of slowly, we're towards kind of the end of the conversation where we've given all these kind of best practices of what should be done and what are, the best in breeds doing. Is there anything that an organization who would like to implement these things and put them forward, what would be the next best thing for them to do? Is there a way to there maybe isn't buy-in from the organization even to kind of move forward these types of initiatives? So what would you recommend as kind of first steps to at least get the conversation started, maybe get a few wins, behind them? What's the best way to do that?
Absolutely. I strongly recommend an employer brand reputation assessment, right? Looking at what are your employees saying on Glassdoor and Indeed. We have put together an index of about 200 healthcare organizations that give the overall count, the overall score. I'm happy to provide an export of all those reviews to an organization and help them analyze what that feedback is saying. The best thing to do is compare that to your first party. So take your last engagement survey. And shockingly, I literally heard from an organization just today. They provided that information to us for an assessment of their internal against their external. And their last survey was 2022. It amazes
Wow.
me. I thought we were a little ahead of ourselves here in that we were doing at least a once a year employee engagement survey. So those are some of the things that before you go down this journey of managing the brand, of publishing something on your website, I think that the first step would be to ensure that as a marketer or as an HR person, that you have ownership of your Glassdoor and Indeed profiles, that you understand what's being said out there, and that you have a clear understanding of what your employer brand is internally on your engagement surveys. Do some checks and balances on whether those are in alignment or not before you take that next step into how do we start addressing this either on our website or online.
Those are great tips. And that idea of understanding or just kind of getting like an audit or diagnostic of like where do we stand, I feel is like a great first step from which to start. On my side, what I would say is that, that I think that's a great first step to kind of get the conversation going internally and start thinking differently about the brand itself. Sometimes the thought process about getting this on board alignment and getting everybody wanting to better improve on and work on the employer brand and how all the repercussions of that. On the other side, some kind of quicker, low hanging fruit wins for communicating all this from my perspective is, well, if you don't have that career page on the website, it's really easy to just add a new page to the website, add some information about the experience, some links to better understand your organization and its differentiators, and link from there to the ATS system. And then that's an easy feedback loop to get done where if you get some feedback from candidates saying, hey, I couldn't find this information, well, maybe you can just add that, maybe a subsection in the career page. So it's really not that complicated to get it started. And then there's huge ways to improve on it down the line. But I think just at a minimum, have a coherent page that's easy to access on mobile and that reduces the number of steps and friction. This is, as you know, one of the thorough points to our conversation is how the patient experience and the candidate experience are similar in their flow. And in the patient experience, one of the things we're always trying to do is reduce friction, make it easier to get to that appointment. And I think it's the same thing. Like, let's just make it easier to find the job you're looking for, to apply for that job. And those are kind of quick wins, I think, from my perspective. Do you have any kind of last insights, or if there's, any ways that people want to reach out to you online? I'm sure we're going to post links in kind of the article or show notes to this. But is there anything else you think as a last kind of thing you want to share as we leave the conversation?
Brad, I think you brought up some great points as far as some quick wins on the website. I think it's just building awareness, right? Just starting the conversation, not ignoring it. Don't put your head in the sand. Just get started.
Sounds like a plan to me. Thank you, Cynthia. So we can both be found on LinkedIn if you need. Cynthia already knows everybody, so it's not very complicated to find her. I'm Brad at Symmetris. Reach out to any of us, and we'll be glad to answer any of your questions. Thank you, Cynthia.
You're welcome. Thanks, Brad.